Morning, friends. Today again we are back with the notes. As we had studied some of the notes, today we have another wonderful notes. It seems to be the medicine which has the capacity to create the wonders in the life. Usually it is said that the castles are often prepared or built on the ruins and the पर mahal बनते हैं. Important message that I am going to give you with this medicines. The medicines known as Pyrogenium. So Pyrogenium, I say that it has got the healing power in the decomposed tissue, things which has rotted, the smelly, dirt. Usually we try to avoid them, but you can wonder that things it can become a powerful medicine. Usually it is said that the lotus flower which looks so beautiful in the ponds, it is emerging on the top of the ponds. It is born or it is built or it is developed from the muddy soils of the ponds. And this is the theme that I feel very much suitable for the pyrogenium. So pyrogenium is a chemical non-living substance formed by living bacteria but also by living pus corpuscles, the pus discharges of the living blood or tissue protoplasm from which the corpuscle springs. That means the things which is decomposing, which is decaying, which is dry, getting rotten, and they create a lot of nuisance in your life. It still have got the living and potentiality to bring some new emergence for the life. This is like creating a castles on the ruins. Now it has different name also, pyroxenes and sepsine, but it is popularly known as the pyrogenum. It is a project. It is a product of decomposed or chopped lean beef in water. The beef are uh, uh, meat of the cattle are chopped and it is put into the water and it is allowed to stand in the sun for 2 or 3 weeks. And after the dilution is prepared, and then it should be prepared accordingly by the burn it and direct without the distillation. So it is direct, no glycerines or no other vehicles are used. Only the water vehicles is used in the beginning. Pyrogenium is known for treating severe infections with putrid and offensive discharges or secretions, stool, urine, breath, vomit, whatever discharges that comes out from your body. You can see the patient coming into your clinic and as soon as they enter into the room, the room is filled with the nasty smells because the sweating, the man was sweating and the sweat was so much dirty that it is very difficult to live with them. Then stool also, the people used to go to the toilet and when they come out, the whole toilet is stink with the bad things. So everything, urine, stools, the vomiting, menses, whatever it may be, they are the. Now it is also found that typhoid fever where the lungs, collection of the lungs are there, then severe sinusitis, peripheral infections, after the childbirth, blood sepsis, and many more. Iodine may also be helpful when there is a history of severe infection and a person either had never felt well since. The person who had suffered from the infections nowadays we have the food poisoning, we have several types of the poisoning, which is and create infections are the disease, and after the infectious disease, many type of the problems remains. It comes on, and never well since. So in the generality chapter, you will find the never well since. है ना? That and under it is one of the valuable indications. Other symptoms includes the sufferings due to the infections are usually restless from aching, soreness, very touchy, viewed sensation as it has been uh, bruised by something, and exhausted, and weariness, weakness, restlessness, and everything. So this gives you the overall picture for the pyrogenium. Now, there is a good history that was published in British Medical Journal in February 13, that is in 1875, where Burden Sandstone, he had he was the first person to suggest the use of this substance as a medicament, and there he wrote this remarkable text. Uh, it's only of the statement many drugs known to homeopathists of fever, he saw that might be turned to a. So there are many. When you see a patient of the fever and you don't find any positions or anything that is related, you can think about some infections are there, and at that time, some infections means something has rotten inside your body, something is decomposing in your body, like stool remaining long, the long standing constipations without urging for several days, and the stool gets decomposed and rotten, and it creates a swelling, and it creates a such type of that nasty flatulence that one cannot hear the things. And at this stage, uh, uh, this pyrogenium is very uh, important. Prestel choose the name Pyrogenium, by which remedy is best known to all of us, and he's because he used to prepare this mother tincture from the water, and he was using it in low dilutions and keeping the preparations in not a remedy. Then again again Burnett, he published a pamphlet on, you may be knowing about the Burnett, who had given a wonderful medicines on the nosodes type of the things. There are several nosodes which from where the history comes from the Burnett one. So Burnett published his pamphlet on pyrogenium in fever and blood poisoning in 1882, and Burnett used the six centesimal dilution, which is perfectly harmless. So he was using it in 60 potency. You know that in olden days, uh, the potency were not beyond the 30 potency. And they were not convinced. You see, later on when Dr. Cage came, the potency beyond 30 were being used in homeopathy. So Burnett was using only sixth potency of this pyrogenium. Uh, and we said that it was harmless and we should keep the ingredient. People used to fear that when they introduce the things directly from the mother tincture, it will create more infections. That's why the people try to use them in the potentized form. This is another reason why the homeopathic potency are being preferred by many of the physicians. And still in every therapy, it is the understanding that medicine should be used in the minimum dose. It is not only for the homeopathy, but in homeopathy we have gone beyond the Regetro's number of the of the molecules, and then but in allopathy also, in different system of medicine, they also prepare, they also administer the medicines in very, very smallest quantity. It is a valuable remedy for treating the several type of the septic conditions. What is the meaning of septic? Septicemia means that the wounds or that the things that is decomposing and it is smelling and it is creating infections. There is a chance that it will get infected. It is primarily used in homeopathy for treating septic conditions, fever, and infections where there are symptoms of severe systemic infections or sepsis. When the best selected remedy fails to relieve the permanently, this is the quotations of Dr. H.C. Allen, analogous to the action of the sorinum and sulfur. In Suriname or sulfur also. It, so latent pyogenic process patient continually relapsing after apparent simillimum. This is another important message for all of us. As pyrogenum is a product of carrion, that is the carrion-like order of bodily emaciation, secretions, and excretion, is the keynotes for it. So whenever you see the body is emaciating, body is becoming thin, there is a secretions are very dirty. All the excretions are the things which is excreted are it is the key becomes the keynote for this study. And with this other leading symptoms are the restlessness, most must move constantly. The restlessness is like they cannot keep idle, they cannot keep silently, so they move on constantly and to relieve their soreness part, to relieve the pain, the sore pain they are experiencing. Now, sir, its uses are there, as I told you, that conditions characterized by severe systemic infections with symptoms such as high fever, rapid pulse is very high, and intense restlessness. Fever, when it is associated with this foul smelling discharge. When you see a patient suffering from the fever for 2 or 3 days old, uh, and when they may come to your clinic, and the clinic will find the body is smelling there. So you can think that there are some infections also. So these are the good hints that we can see in the patients also. Then abscesses, where the abscess, the wounds or any type of the abscess which comes up, like any of the skin eruptions, and which is not healing, which is not going on. So in that conditions also it is being used. Then after the post-surgical infections, after surgical surgery is a very common phenomena, and after surgery there are some type of the infections develop, and it becomes difficult to wound. These two surgical shutters which has been put, they start developing for tendency to cause development, and here it becomes the pyrogenium is used. Then puerperal sepsis infections followed after the childbirth. Yeah, in the lady who had just given the childbirth, and even with the normal childbirth, there may be the infections because of the handling by the nursing staff, and the sepsis condition will comes up. So at that conditions also this medicine is used. Then symptoms are high fever with the chill, with sudden onset, profuse sweating. See the conditions you can, as you can in the repertory you have to associate all these with in high fever, but patient is feeling very chilly. The fever comes suddenly with the profuse sweating. There is aching in the bone, limbs, extreme restlessness, and offensive discharge. Then septicemia. Highly indicated in the septicemia, that means the blood poisoning and severe systemic infection, high fever, often present with the high or sudden or onset fever, frequently alternating with the chill. Then rapid pulse, the pulse are very disappropriately compared to the temperature. Then offensive discharge, foul smelling discharges from wounds, abscess, or the body orifices. Their restlessness, extreme restlessness, and need to move constantly, often described as a sense of unease or the discomfort. Fatigue and soreness. General feeling is being bruised as if they have been beaten by someone, so that the bit or if they have got some scratched over the body, as if they have fallen on it, from the eye place, and the pain is, the bone is paining, muscles are paining. So that is called the bruised sensation. And delirium, confusion, feelings being all sort are marked pictures. Then mental picture of the Pyrogenium is that they are very locusts. They can think and talk faster than ever with irritability. They are delirious. The delirium comes as soon as they close their eyes. They see the man. Someone is there. Someone is sitting at his foot of the bed. Then whispers in sleep, whispering there in the sleep. Sensation as if she is covered the whole body. Knew that head was on pillow, but did not know whether the rest in body was. So she feels, the patient feels that the head is on the pillow, but where is the body? They don't know. And feelings when trying to lie on one side and that someone is lying beside the patient, there are the sensation. This is important sensation as well. So they also feel another person when turning in the other side. So patient is lying in the middle. When the patient turns one side, he feels that some person is lying. Then again he makes a turn and he feels that some other person is lying with him. So these are the delirium delusion that they have. The sensation as if crowded with the whole body is crowded, is put there are the arms and the legs are there. Then they have the hallucinations, they have become very wealthy. And remaining after the and it still remains after the fever. The fever is gone and they feel that they have become wealthy persons. Uh, Generally, they cannot lie more than few minutes in one position. So change constantly. Debility in the morning and staggered or trying to walk. The beginning to walk, they stagger, nervous and restless, aching all over, bed feels hard, great muscular debility, weakness is there, rapid recovery in few hours, muscular debility and rapid. See, debility is there, but when it starts, motion is there, they feel very active. Skin are pale, cold, of ashy color, obstinate, very cold, offensive ulcer of the old people. Then slept while awake. She is sleeping, but she feels that she is not sleeping, and dreams of various things of the business. Then positive factors, as I told you earlier, that the main positive factors is the blood poisoning. Stomach poisoning means the food poisoning. Then severe gas poisoning, typhoid fever, remote effects of the typhoid fever, dissecting wounds, post-surgical infections, peripheral sepsis, that is the septic conditions after the childbirth, then abscesses. So these are some of the positive factors that you can find with this medicine. And modality, the patient is better by motion, changing position frequently, and warm applications is better. And the worst conditions are the cold, damp weather, rest, they cannot lie on the bed, inactivity, if they are not doing anything, they feel bad, and during the menstruation in the women. The keynotes point are now the four features you must remember in the about the carcinosum is that offensiveness, temperature, pulse discrepancy, not inappropriate, and systemic impact. The key differentiating factors: high fever with low pulse. Anna, remember, the fever is high. Usually the fever, this is that differentiating point. Fever, if you see the pulse will be low. But usually it happens that with the temperature or the pressure, the pulse rises. But here the pulse is low. This is very much important for this medicine. Restlessness, a strong need to move constantly to alleviate the discomfort. Marked prostration, weakness, severe fatigue and exhaustion even with the minimal exertions. Slight exertions make them weak, to feel weak. Then usually in the potency, high potency. Nowadays we are using the high potency beyond 30th, 200 potency, 1M potency. But previously it was suggested that 6th potency to 30th potency, and nowadays higher potency, and should not be repeated frequently. It should not be repeated frequently. This is important message for, and this is not only for this medicine, but almost all medicines of your America. Relationship, Septicin is another medicine. They are identical. Malar is another vegetable pyrogen. It is known as the vegetable pyrogen. Lachesis in typhoid with soreness where it feels hard. Bacteria arnica rustux. Rustux is better by the motion and stretching limbs. Rustux comes better by motions and in warm weather room, and brinier with the uterine hemorrhage. Ipica uh, with the offensive diarrhea, sorinum, a black stool. Leptendra, constipation, opium, sanicula, plumbum, lochia, thin liporia, fetid, nitric acid, vomit, water as soon as becomes warm, phosphorus. And throbbing headache with the belladonna, varicose offensive ulcer of the old person with the sorinum, then as in acid of the sickly cord and suppuration of the people. So you have to be careful about using this medicine. Then there are another indications. Burnett has been using this medicine in 6th potency, which is perfectly harmless to what he says, and he took, uh, prepared this medicine to use and gave it to the Swan also of the New York, and they used it, they ran up into the higher potency. You know that Swan was known for the person was introducing, who has introduced the high potency in the homeopathy. Much of the American experiences, Swan attenuations include proving Severino, whose symptoms I have marked in the schema of the club. The schema of the symptoms that which was proving symptoms, and the schema that is followed in the Clark dictionary are based on the Swan's proving. In its pamphlet, it included successful experience of Dr. Solden with Pyrogenium 6. And these are some of the experiences in 2 cases of the ferric throat create. I have had ample opportunity of observing the power of Pyrogenium over the typhoid fever that he writes, and typhoid and hectic states, including one of the discharging abscess connected to Pott's disease of the spine. T.M. Dingling reports the case of young German Jew who had been under treatment for various hospitals for Bright disease and at the Hennimans Hospital in New York alone. Another important message that we can learn from all these messages is that the patient who is hospitalized for a longer period, they become very much prone with the infections. That is called the hospital infection. Different type of the patients are coming, and with this hospital infections, the patients, long-standing patients remaining in the hospital for more than 10 to 15 days or more, or they are bedlying for the several months. Uh, they are liable to take up the infection, and at that conditions also you can think about the urinum also. HCLN says, Pyrogenium is a great remedy for septic elements, septic states with intense restlessness. Peripheral, and this was the remark of the, and he gave that tomaine poisoning. Tomaine poisoning means food poisoning, diphtheria, dissecting wounds, spear gas poisoning. All these are the things that I have referred to you earlier. A young man with a good inheritance suffered from blood poisoning and made poor recovery for several years, was affected with sepsis. This is the example of Dr. Kent in various parts. He was pale and sickly, rheumatic and stiff at this time. So People used to suffer from the blood poisoning, and they can remain sick for years together. And at that time, this medicine is very useful, which is experienced by Dr. Kent himself. The Boger was a very good clinician, and he remarks that aching, bruised sore, and prostrate yet restless, bed seems hard, bone pains, foul taste, secretions, odor for of bloody and rosy red marks. These are the good experiences that has been observed in the past by the stalwarts. Then leaders in homeopathic therapeutic by E.B. Nash. This is one of the important popular books among homeopaths. The Dr. E. Leader in homeopathic therapeutic. It is a book by E.B. Nash. I have not used it remedy myself, we admit. Uh, and if the Allen's keynote are reliable, it must be a great. He says he admits that he has not used this Pyrogenium, but he says that because it appears in the Allen's keynote, so it must be very useful and great value. A remedy recommended so highly by such authority for septicemia, peripheral, and surgical and for the diseases originating domain or severe disease. Let me quote. He's quoting. This is the quotes from Dr. Uh, the bed feels hard, which is very much similar to the arnica. Parts laid on one sore, uh, bruised, lying on they feel the bruised section. Rapid decubitus, that means it's a bed sore, carbolic acid. Weightlessness must move constantly, ameliorated by soreness of the part, arnica, epitorium pus. Tongue large, flabby, clean, smooth, if varnished, fiery red, dry cracked, articulations difficult. As might be expected, anthracynum is another important source. This is also useful, but horrible body is there. Now there are several rubrics that there are many other rubrics that you can see in this in your rubric, but the rubric that I'm presenting here, it is only a key rubrics. I can, you can say the key rubrics that you can consider, but it is not that the other rubrics are not useful. Severe infections and septic conditions in the general chapter, high fever with rapid onset and extreme restlessness in the fever chapter, offensive discharge and feeling of internal heats in the generative chapter, extreme restlessness and irritability in the mind chapter, aggravations with war and aberrations with the rest in the generative chapter, the mind loquacity, talking too much, then delirium, closing eyes on, delusion, bit. If someone is lying, it is another rubric that you can get. So delusion, hard, everything seems to be and sins are perverted, then delusion that he has got the will. So these are the important things that you can. Uh, this is only a reference purpose I have given you. It is not that because individuality is a factor. In different patients, you will find the different type other rubric, but you have to look for them also. So, Pyrogenium is a valuable remedy for septic states and offensive discharge. Knowing this in 1870 creations is not so surprising. Chopped leaf deep in water, exposed to the sun for several weeks before being potentized. Fortunately, the potentization process of homeopathy removes all trace of the source material so that remedy produced pyrogenium is a safe but highly effective energy remedy. Energy remedy or equal to interest is that today we still draw those first potency produced some 150 years ago. Now, at the last, I can say the cause may also evoke the cure. UB vanadium IBI remedium. That is what is the cause, that is the remedy. And homeopathy has produced a wonderful remedy for dealing with obscure septic conditions. That remedy is called Pyrogenium, and Dr. Bradford the veteran homeopath and Dr. George Christopher has given my reader a very valuable section. I have my personal case of the papa where I was very much experienced the effect of so fast and magical experience of Pyrogenium. A boy, young man of about 18 or 19 years age, he suffered from the appendicitis and suddenly it got busted and the pus started bleeding inside. The patient was suffering from a high fever and the patient was immediately admitted in the hospital, rushed to the hospital for in the emergency for operation. And after the successful operation, usually the usually the appendicitis which burst inside, the operations they takes longer time in the surgery because all the debris that has scattered in the abdominal area, it has to be cleaned also. And it is liable that even after proper cleaning, the appendix, appendix which got busted, some debris are remain. So the doctor said, the surgeon said now that everything is cleared. They have closed the abdomen also, and the patient was put into the intensive care ward. After 2 days, the patient started having with a fever, high fever, very high fever. And with the restless patient was almost unconscious with the fever 104, 105, and it was constantly remaining. So just that at that condition, and we were not allowed to see the patient inside the hospital. So I just only asked for the hair, and I transmitted the hair Pyrogenium in the 0/3 potency, 0/3 potency. And immediately by evening, the patient's fever came down, and by next day, the patient was feeling better. So this is the miracle that I have. Thereafter, I have used the Pyrogenium in several cases, but that case was very reminding for it remains in my memory as I have. It gives me a new insight about the Pyrogenium. So with these things, I just say thank you to you because this is a wonderful thing, and you can uh, you have to learn more and keep reading the books. Into that Clark dictionary, you can find a good account for the Pyrogenium. There are other mathematics also where you can see, but Clark dictionary gives you the good account for the Pyrogenium, and you can get good picture about the Pyrogenium. So with this I conclude my session, and I wish that you have much got insight. But don't be desperate when you see the patient. And with the emergency, just try to maintain a patience. This is very important when you use the as a physician. So patient doctor, if the doctor don't have the patience, they are to observe and wait. And if they get frightened themselves, they can never cure a case. This is important things that I can share with you. And I, uh, I hope I have given you some insight into the Pyrogenium. And with this, I conclude this session, and we can meet again in our sometimes in next session. Thank you. Thank you very much.